I think we should call this In Conversation. Today we're in conversation, but we don't say doctor with cardiologists, we say Mr, don't we?
Well, Mr's more for the surgeons, so they're the ones that do the
So we can say Dr Alistair Begg.
You can,
Yeah.
Dr Phil Sheldon.
I know we're not going to talk about this because we're going to talk about cardiology, because you are a cardiologist at Ashford,
right.
Ashford Cardiology, and that is your speciality, besides juggling and baking, I believe, as well. No, just teasing you. Why? I remember reading one time why surgeons are Mr. and why there was that difference. Well, I can't remember what it was, but is there a story to that? Do you know?
I'm not too sure.
No, I think
they probably used to be the barbers, I think.
Yeah, well, I think it was.
Yeah.
I think it was because outside the barber shop you've got the red and white between blood and bandages,
That's right.
and because they were able to shave and do minor surgery at the same time.
That's right.
Yeah, and I'm sure it was and I'm sure it was to do with when the Royal College of Surgeons came about and they differentiated themselves from the medicos and the apothecaries and all that sort of thing.
They had different training schemes, I'm
sure.
Yeah.
Well, of course, though, but you must realise though that I am now a real doctor.
I know.
See, you guys, you're just medicos. You're just MDs.
I know.
You've
probably done just as much training.
We're the real, us PhDs are the real doctors.
Probably harder to get your doctor too.
No, I don't think so. I couldn't imagine myself there with opening someone up from down to there, splaying the ribs over and doing a triple bypass or quadruple bypass or stents or all the rest of it. No. I leave that to you with much encouragement. Hopefully I will never need your wonderful skills.
Well,
and
if
wonderful
we do a good job, we don't have to use the surgeons do it.
You know, natural medicine is something that I think gets a really bad rap. And I don't want to ask you a question and answer it for you, but someone presents to you, they've been referred to you as a specialist, and there they are with raging high blood pressure, ridiculously high cholesterol levels, they're overweight, they smoke, they've got serious heart conditions.
Yeah.
Are you going to tell them to take fish oil, some coenzyme Q10, go away and everything will be fine?
Well, look, there's a certain level where you hit the button and you actually have to treat these people. So there's a certain level of blood pressure, a certain level of cholesterol, and that's high sort of numbers.
But you can't let them, you can't in all consciousness let them walk out of your rooms.
You have to address all these risk factors. You've got to really take the heat out of the situation. So that's where your medication comes in.
But it must be hard knowing that if Charlie stopped smoking, lost 15 kilos, started walking, started doing these things, then a great deal of your services will be redundant.
Well, we're still required, but we're more required in the prevention side of it rather than the treatment side.
Yeah.
Okay, so I mean the key really is to get on top of those burning issues to start with, but in the longer term try and make a difference. And obviously the medication is important, but we're also looking at the whole range of sort of things you can do, all the lifestyle options, all the dietary options, reducing all your risk factors to try and reduce your risk of having a heart attack, basically. So
I'll come to that, but the reliance on medicine within our society, where we've enabled diseases which weren't really diseases to be then classified as diseases and then come out with drugs. Now, we need drug companies, and the amount of money they put in research and development is huge, and without many of the drugs we have today, people's lives would be intolerable. So as many on the alternative field would do, to just rubbish drug companies, I think is a stupid and very short-sighted thing to do.
Yeah.
But we do have that middle course, don't we, to a degree, where we look at many of the medicines, or I do, and think, well, do you really need that? Is that the most necessary thing to have? And I know if someone presents with very, very high cholesterol and they're not doing anything, you've got to prescribe a statin, and they work. I mean, they do work. Not everyone I know can take them.
Yeah.
But it must be hard for someone like yourself who does have an interest in natural medicine, it does have an interest in natural ingredients.
Yeah.
To sometimes want to say, well, have you looked at the life? How do you handle that?
Yeah, well, look, I think they've got to work together. Like you can't just give the medicine on its own and not do the other things. Likewise, you can't just do the other things and ignore the medicines. They've both got a role to play, and I think bringing them together is you're going to get the best outcomes for everyone, including the patients, the doctors, the system. So it's working for everybody basically. So
many of your colleagues really don't give very, very short, sharp shrift to natural medicines, and I understand why, because when you've got many alternative, and I hate the word alternative, but they consider themselves alternative, so you've got alternative practitioners and to a degree complementary practitioners who think that, you know, their Q10 and their magnesium and their fish oil has all the answers and you need nothing else, and take niacin and everything will be wonderful for your cholesterol. And so a lot of your colleagues would dismiss that completely, which I think is a little bit like throwing the baby out with the bathwater, horrible expression. There has to be a middle course.
Yeah, well look, I mean, I think there's room to try and reduce your cholesterol, reduce your blood pressure with you know, lifestyle therapies that are proven. A lot of these other complementary medicines have a role, and they do work in many cases. I think as long as we stick to things that are evidence-based, and not just go with the big advertising that a lot of people do, and I mean, I see it every day in the media, you know, take fish oil and it'll do this and do that, and when you actually look at the evidence, sometimes it doesn't always fit in with what the advertising fits in. So I guess that's perhaps what's given it a bad name, you know, if you look at why. Having said that, you don't, as you say, you don't want to throw the baby out with the bathwater, because there's still a lot of good things you can do apart from taking pills, or as well as taking pills, that make a big difference in the long run. So
I think if we take them into blocks, and I want to talk about your book and your DVD and the work that you're doing in trying to get these lifestyle changes into people. So I think if we maybe we look at lifestyle, we put lifestyle there, and that is the healthy diet, getting exercise, dealing with stress, giving up smoking, you know, moderation in those things such as alcohol. We know a glass of red wine can be beneficial, but 2 bottles ain't so good. So all of those. Then we come to the supplements, the natural supplements, and it's something that I have a concern about. I have a concern that, you know, there are many offering supposed cures by saying, well, you know, the fish oil will do this, or krill oil will do this. To be frank, I have never seen a definitive study that has shown me that it will make that much difference, you know, on its own. If you just, I mean, if you've got all of those conditions that we just mentioned, the high blood pressure, the raging high cholesterol, all of those problems, well, you can take fish oil all day long by the bucket load, and I don't think it's going to do an absolute thing unless you start doing those other things.
Yeah, well, it's got to be a comprehensive approach. That's the whole thing with all of basically medicine these days. You can't just do the operation and say you're fixed. Don't worry about it now. I mean, that's you know what perhaps used to happen, but now we have to look at, well, the operation's all part of a range of treatments and preventative sort of strategies that we offer.
But you're not fixed, are you? If I present to you someone with blocked arteries and you've got to do a double or quadruple or triple bypass, they're not fixed.
No,
you've done the plumbing work brilliantly. Brilliantly. But if Charlie goes back out there, and to another extent Mary or Kathleen or whatever goes back out there and makes no changes, they could be back on the table within a few years.
That's right. Exactly.
And it's not, you know, it's not, I mean, unless you get a surgical procedure where you actually put a zip down the front and then you just unzip them again to do it. Have you thought about that for the ones that keep returning?
The zipper, I mean, it's a zipper club, isn't it, for some people? But unfortunately, with newer treatments, we're not seeing as much of them.
No.
And I mean, that's largely due to the reduction in cholesterol and the reduction of the risk factors like smoking and blood pressure and those sort of things. So fortunately, we're not seeing nearly as many people having bypasses now.
But there are cases genetically, and I know we spoke just now, where they're doing the right things. They're really trying, but it's not working for them.
I mean,
that's a hard one.
That is a very tough group, because a lot of these people have bypasses, you know, when they're 50, and then they're looking at another one or a heart attack or worse, you know, at a very young age, and they're the group that's often difficult to treat. Sometimes they don't respond well to the medication, or they may not be able to take the medication, and it really leaves them between a rock and a hard place. So everything you can do to try and get your cholesterol down all makes a difference. So, I mean, I see a lot of those people, and they're the sort of people that often come to see a cardiologist because they have problems because their cholesterol is not well controlled. So that's a tough group to treat, and they don't do well. So, I mean, there is a lot of good evidence that if you get your cholesterol down, you won't end up with those sort of early onset long-term problems that these sort of people get. So.
And without many of these medications that a percentage of the population dismiss, these people wouldn't be around.
Exactly.
They wouldn't be seeing their children grow up and seeing their grandchildren and being part of life. They wouldn't be here.
Exactly.
And that's something else I think we need to consider.
Yeah.
You know, the importance of quality of life. You
Yeah.
know, but then I know because I've dealt with it when I was in practice myself. Someone that will go out and not make the changes, have the high fat meal, drink the too much and go, well, I'll just take an extra statin.
Yeah, well, unfortunately that doesn't always work, and you know, a lot of people think they can cheat the system by taking the tablets, but it catches up with people because their weight will go up or their sugar will go up or other things will happen to them. I mean, sure, their cholesterol might be okay, but if they're 150 kilos, it's going to have other consequences. So
it's that holy trinity,
yeah.
not to be irreligious to any of our viewers,
yeah.
but you know, the blood pressure, the high sugar, the high cholesterol, you've got those three, which is a recipe for a really bad outcome.
And a lot of those three can be dealt with lifestyle, you know.
Yeah.
So you, rather than just treating one, you're treating.
Now you said lifestyle. This is something you put a lot of work into because you've got a video and a book, and I know you put a lot of time and a lot of effort. Tell us about the book and the video.
Sure. Well, I mean, the video is a rehabilitation video, and it's available for people that are either have a heart problem or want to prevent a heart problem. And it details all the sort of dietary types of interventions, the medication that people are on, the lifestyle sort of issues that they have to deal with. Plus, it goes into detail about the surgery and the stents and the pacemakers and other things that people can have done. But it's more building awareness of what sort of treatments are out there and how to avoid a problem. And it's basically, it covers all the key components that we deal with in cardiac rehabilitation, which is prevention of another event, basically. So we've put that together, and that's now available for people to purchase. And you can get it through the Heart Foundation. We've managed to get them involved as well.
Fantastic.
So they see that there's a need for this sort of thing as well. I mean, I saw that a couple of years ago. There really wasn't a lot of uptake of cardiac rehabilitation. So once people have had their procedure or their stent or their bypass, they weren't necessarily coming back to the hospital to get fully educated about the whole process.
Yes.
I mean, they may have gone back to the cardiologist or the GP, but they weren't really understanding the whole process because it takes a long time to understand exactly what's going on.
Yeah.
And the people that have been through cardiac rehabilitation, they'd have better outcomes because they understand why they're taking the medicine, what they have to do to prevent another problem. And it really works. So we're trying to really push that along.
Fantastic. Is there a website?
There is. It's www.whatswrongwithmyheart.com.
That's a nice one.
So easy to remember.
Yeah.
And also the Heart Foundation. So if you go to the Heart Foundation, National Heart Foundation website, on their online shop and click on the resources, you'll find the DVD there. So if you want to support the Heart Foundation, you can go to their online shop as well.
So to finish off with a couple of tips that people should look out for, and a couple of recommendations that you think they should be doing.
Basic tips: stop smoking if you are smoking. That's the number one cause, particularly for young people. Lose weight if you're overweight. Exercise daily. That's very important. Reduce your stress. I mean, stress is a big factor, both in terms of causing disease and also making the symptoms worse. And just understand what the process is so that you know why you're taking your medications, what they're for, when they're necessary, what other things you can do to try and reduce the chance of you getting a problem, basically. So education is the
with
key.
women, often quoted stats such as for every one woman that dies of breast cancer, over 8 or 9 women die of heart disease.
Exactly.
Is that still for true?
Well, I mean, there's a lot of attention on breast cancer, but if you get breast cancer, the chances of you dying from it are not nearly as great as having heart disease. So people worry about breast cancer, and that's very important to focus on that. And prevention is very good, early detection, etc. But unfortunately, when you get heart disease, your risk of dying from that is much greater. And yet people sort of have more, perhaps there's more of an emotional involvement perhaps with breast cancer, but heart disease is still a big killer. And you're more likely to die of heart disease than breast cancer. So
I don't want to make a light-hearted remark, but in the sort of Melbourne Cup of diseases, we've had cancer in the lead, tipped just by heart disease, and then cancer's taken over. Where are we now? We're about line ball?
Well, we're still more likely to die of heart disease, really, because people are tending to get it later in life. That's good. I mean, obviously it's important to prevent the onset, but if you can prevent getting it at all, I mean, a lot of these people can live well into their 80s and 90s with good quality of living. And we're not just focusing on length of years too, it's quality of life. Yeah, so if you can have an active, healthy life, that's the most important thing, and avoiding that heart muscle damage that happens with a heart attack.
Because it is a muscle, the most important muscle in the body.
It is.
But it is. And another very disturbing statistic I saw the other day was that, you know, this current generation and the next generation coming will probably be the first generations in the history of humankind to actually see a decrease in longevity.
Yeah, well, certainly these days there's a lot more issues with people not being active, being overweight. You know, the national average waistline keeps going up.
Yeah.
So all those issues that we're seeing now are going to have long-term implications for the health of the nation, really. So doing something active now is going to make a big difference.
And you can't change your genes.
You can't change it, not yet.
But you can change your lifestyle.
Yeah, that's right.
And that's
right.
the key.
Exactly.
Alistair, thank you so much.
Thanks, Phil.
My pleasure. And don't forget, have a look on the website. I've got a new product out called Healthy Heart with a lot of those natural ingredients. Not a cure, but something you should look at, and that's available now. Take care.